I'm Matthew Olivier. I grew up about 5 minutes from URI. I graduated in 2006 with a Pharm.D, and that was the only degree. I didn't have a business degree or background. And then I opened up Mass Local Pharmacies almost exactly 3 years ago. And we're still growing quite rapidly. We're just evolving with pharmacy, which is what you have to do to stay afloat. And as you know, over half of the independent pharmacies in Rhode Island have closed in the past like 2 or 3 years. So that kind of shows you how challenging it is right now to be in business as an independent pharmacy in Rhode Island.
I know it's definitely tough, and I'm excited for Greenline that they're moving into a bigger space because that definitely gives them more room to grow.
Absolutely. And we can talk about it, but I think you got to keep in mind, like, I went in thinking if I did a lot of volume in my spot that I would be fine. And that's why I opened up across the street from my competition. But as you probably are learning, the more volume doesn't necessarily mean more money in your pocket. It's actually, you can lose more money. So it's all about being smarter with your business, which I'm constantly challenged with, and we can talk about that too.
Yeah, definitely. So why did you choose URI for the pharmacy program?
So I grew up, like I said, locally, and I love Rhode Island, and I still live here, and I don't ever want to leave. So one thing, I just love the area. And I think when I started looking at majors and degrees, the College of Pharmacy at URI just had a really strong reputation. And I still feel it's probably the best pharmacy school in New England. There's been a lot more opening up, but especially once you get out of college, you start to see other graduates from different colleges, and you kind of start to feel like you kind of stand out with a better knowledge of pharmacy as a whole. And I feel like URI definitely prepared us with a great foundation for a pharmacy career.
Yeah, absolutely. So what made you want to open your own business? I know you said you worked at CVS before.
I did. I actually started at CVS in Wakefield when I was a senior in high school in 1999, and I worked with CVS all the way up until 2017. And I loved the job of retail pharmacy, but I started to kind of get a little burnt out with the pace of work, and I think working for somebody else was starting to kind of wear on me. So I started to look around, and I worked at Newport Hospital. I worked in the chemotherapy center, which I loved, but I was kind of missing that patient interaction. So I was kind of still kind of trying to find my way. And I went to an ownership meeting for all these independent pharmacy owners in Rhode Island. And there's about 15 people. There's probably like 4 people there now. But when I was there, what I really noticed is these people were really passionate about their career. To me, it was kind of a aha moment where I looked around and I said, well, in 10 years, who do I want to be? And it might be hard to get there, but I don't want to be that person that's not happy at my job every day. So yeah, it's going to be a lot of work, and I'm still trying to get there, but I knew what my goal was, and I knew if I worked hard enough, I'm going to get there.
Yeah, definitely. What do you feel like is the most rewarding part of having your own business and kind of being your own boss?
It's been kind of surprising the impact, like the magnitude of our impact on the community. Like Newport and Middletown's a pretty small, tight community, and it's pretty cool to go around, and like Matt's Local Pharmacy has become like a thing and a place now, and just the positive type of feedback we're getting really everywhere we go has been pretty amazing. So you definitely get some reward at the end of the day, even though they're exhausting and they're long. It's pretty much getting that feedback from your community, which I've always enjoyed as a retail pharmacist. I think if you're going to be in retail, you kind of have to enjoy those types of things, but getting that positive feedback from the community has been great.
Yeah, and that must be so rewarding that your name is on that business.
It's kind of turned into a joke because every single phone call, and you probably see this at Greenline, like every single phone call, they want to talk to Matt. And I just tell people, I'm like, if you open a pharmacy, don't put your name on the sign. Like, because everyone calls and like, I need to talk to Matt. I'm like, it's a curse at the same time.
I didn't even think about that, actually. That's probably very true. You probably are like, anybody that calls is like, okay, I need to talk to Matt. That's the only person.
Oh yeah. Oh yeah. It's tough sometimes, for sure.
Yeah. So how do you feel like URI in particular prepared you for this role?
So it was funny because I didn't have a business background, and I really had zero independent pharmacy experience. So I was trying to kind of brainstorm this question. And what I think URI did really well, like I said before, is they give you a really good foundation. And I really encourage people on their last year of college when they're doing their rotations to really search for what they're looking for, because that amount of experience of what you're getting, you don't get again in your career. So I think getting that type of exposure to so many different types of careers within pharmacy was very valuable. And I feel like they did an excellent job at just kind of giving you a good, diverse type of exposure to what's out there in pharmacy. So URI in general did a great job at giving you a great foundation as a pharmacist once you graduate.
Yeah, I agree for sure. I'm on rotations right now, so I've definitely noticed that there. I mean, every rotation's been different in some way. So I'm lucky that I've been in person for most of mine with COVID and everything, but
Yeah,
it's definitely been good. I have no complaints about it. So
yeah.
and then how do you see the profession of pharmacy evolving, and how will you adapt your business to that?
So I looked at this question. I think the way I was interpreting it is, how do I see the independent pharmacy profession progressing? And it's pretty apparent now with pharmacy benefit managers and DIR fees, which is something that most people don't even know about. It's really kind of squeezing the independent pharmacy business, and that's why we're seeing all these pharmacies close. So it's important to kind of look for your business outside of those avenues. So we're looking into things that do not involve billing PBMs like CVS Caremark, Express Scripts, Optum. We have to look for services that are service-based, such as like vaccines. I'm looking into maybe some DME, and compounding is kind of a no-brainer. I'm trying to push it in that direction as well. But every year, like, I have a different idea of where I want the pharmacy to move towards.
I feel like it's nice to work in an independent pharmacy because we do have those opportunities to be unique and do things that are kind of outside of the box of traditional pharmacies. So definitely a positive about independent pharmacy in particular. Well, thank you so much. I hope you have a good day.
All right, good luck with the rest of your school for sure.
Thank you.
Bye.